Last year, I sat across from a 71-year-old woman named Patricia, who had been on 3 blood pressure medications for 6 years. She was doing everything her doctors told her, taking her pills on time, reducing salt, avoiding stress, and her pressure was still not where it needed to be. When I asked her what she cooked with, she said canola oil. When I asked what she drank with meals, she said water or juice. When I asked what time she ate her last meal, she said around 9 p.m. 3 answers. 3 things that were working directly against every medication she was taking. Nobody had ever asked her those questions. Today, I am going to show you 5 specific things you can add to your daily routine, starting tonight, that work on blood pressure through mechanisms your medication cannot reach. Not to replace what your doctor prescribed, to give your arteries what pills alone cannot give them. Stay with me because number 3 is the one that most people have never connected to blood pressure at all, and it may be the most important one on this list. I'm Dr. Jake Taylor. Before we go further, are you currently on blood pressure medication? Type yes in the comments. I want to understand how many people in this community are managing this right now. Here is what your doctor does not always have time to explain. After 60, blood pressure does not rise simply because of stress or too much salt. Something structural is happening inside your arteries. When you were younger, your blood vessels were flexible. They stretched under pressure and absorbed it. As you age, the walls of those vessels begin to stiffen. They lose elasticity, and a rigid vessel cannot manage the same pressure a flexible one can. Your heart has to push harder just to move blood through the same pipes. What causes that stiffening? Chronic inflammation. Slow, silent, invisible inflammation in the walls of your blood vessels. You do not feel it happening. There is no obvious symptom. But day after day, year after year, it quietly hardens and narrows those vessels while your heart compensates by working harder. What drives that inflammation? Largely, what you eat 3 times a day. Every meal is either reducing the inflammation in your vessel walls or adding to it. Most people have no idea which one they are doing. That is what changes today. There is one more thing about arterial stiffening that almost nobody explains clearly. After 60, your body produces significantly less nitric oxide than it did at 40. Nitric oxide is the compound that tells your blood vessel walls to relax and remain flexible. When nitric oxide production declines, vessels stiffen faster and respond less effectively to the pressure signals your cardiovascular system sends them. This is why 4 medications can still leave someone's pressure dangerously high. The medications are working on specific pathways, but the underlying loss of vessel flexibility from chronic inflammation and reduced nitric oxide is something that requires a different approach. 3 of the 5 things I am about to show you directly address nitric oxide production. That is not a coincidence. Subscribe right now if you have been managing blood pressure for years and nobody has explained this to you before. We publish every week for people over 60 who deserve this kind of direct information. 3 seconds, subscribe, and let's continue. The first thing is so simple that most people dismiss it before they try it. And that is exactly why it keeps working for the people who do try it. Eat your vegetables first at every meal, before the bread, before the rice, before anything else on the plate. Here is why this matters for blood pressure specifically. When you eat vegetables first, the fiber in those vegetables forms a physical barrier in your stomach. That barrier dramatically slows how quickly sugar from the rest of your meal enters your bloodstream. And when blood sugar spikes sharply after a meal, your body releases a surge of insulin. That insulin surge causes your blood vessels to constrict, to tighten. Right there at your dinner table, your pressure is rising and you have no awareness of it happening. I have had patients change nothing else. Same food, same portions, same medications. Just the order. Vegetables first, protein second, carbohydrates last. Their post-meal blood pressure readings dropped measurably within 2 weeks. Helen was 73 and had been struggling with blood pressure spikes after dinner for months. Her evening readings were consistently higher than her morning readings despite her medication. When I asked about her eating pattern, she always started with bread while waiting for the rest of the meal. We changed one thing: vegetables before anything else, every meal. 4 weeks later, her evening readings had stabilized. Same medication, same food, different sequence, different result. The mechanism is not complicated once you understand it. Your post-meal blood sugar response is one of the most underappreciated drivers of blood pressure variation throughout the day. Controlling it costs nothing and requires no prescription. And here is something that makes this change particularly powerful for people who are already on blood pressure medication. The post-meal spikes that occur when carbohydrates are eaten first often happen in the window between medication doses when drug concentration in the bloodstream is at its lowest. You may be well protected in the morning when medication levels are high and relatively unprotected in the evening hours when the same carbohydrate first dinner is producing the largest insulin-driven constriction. The vegetable-first approach addresses this vulnerable window directly. It does not replace your medication. It covers the gap between doses that medication alone cannot fully manage. The second thing has been sitting in most people's kitchens for years doing nothing. Apple cider vinegar, 1 to 2 tablespoons in a full glass of water with each meal. I know the skepticism that comes with that sentence. Good. Skepticism is appropriate. So let me show you exactly why this works, because the mechanism is real and it is documented. The active compound in apple cider vinegar is acetic acid. Acetic acid does 2 specific things that matter for blood pressure. First, it improves insulin sensitivity. It blunts the post-meal blood sugar spike we just discussed, reducing the amount of insulin your body needs to release. Less insulin means less vessel constriction. Second, acetic acid stimulates the production of nitric oxide in your blood vessel walls. Nitric oxide is your body's natural vasodilator. It signals your arteries to relax and open. It is doing naturally for the cost of a bottle of vinegar, something that an entire class of blood pressure medications works to achieve pharmacologically. One important caution: never drink it undiluted, always in at least 8 ounces of water. Use a straw to protect your tooth enamel. If you have a history of acid reflux or stomach ulcers, speak with your physician before starting. For most people over 60, this is one of the simplest, safest additions available. 1 tablespoon in water at breakfast, 1 at lunch, 1 at dinner. Give it 3 weeks and check your numbers. Margaret was 72 and had been managing blood pressure for 8 years. She had tried various dietary changes recommended by different physicians over those years. Less salt, less red meat, more potassium. Each had produced modest improvement. When she added apple cider vinegar with meals, she was skeptical because it seemed too simple. At 4 weeks, her cardiologist noted that her post-meal pressure readings, which had always been her most problematic numbers, had stabilized in a way they had not managed to achieve with dietary adjustments alone. The mechanism was not mysterious. It was the insulin response. Her meals had not changed, but the rate at which sugar from those meals entered her bloodstream had been significantly moderated. Her vessel walls were experiencing less constriction at every meal. Across a day of 3 meals, that reduction accumulates into a meaningful difference in the total pressure load her cardiovascular system handles. The important thing to understand about apple cider vinegar is that it works most consistently when used at every meal, not occasionally. The acetic acid's effect on insulin sensitivity and nitric oxide production is dose-dependent and timing-dependent. Irregular use produces inconsistent results. Consistent use produces consistent benefit. This applies to all 5 of the things I am describing today. None of them are dramatic interventions. All of them work through cumulative daily effect. The third thing is where most people raise an eyebrow, because nobody thinks of it as a blood pressure intervention. But the research behind it is consistent and the mechanism is specific. 30 grams of walnuts, approximately 14 halves, eaten 30 minutes before bed. Your blood pressure is supposed to drop during sleep. That nighttime dip is when your cardiovascular system gets its only real recovery window in any 24-hour period. In a condition called nocturnal hypertension, which affects a significant proportion of adults over 60, that dip does not occur. Blood pressure stays elevated or even spikes during the night while you sleep completely unaware. Your heart works overtime for 8 hours. Your arteries are under sustained stress, and you wake up tired, often with a higher morning reading than makes sense given your medication. Walnuts address this specific mechanism. They are one of the richest plant sources of alpha-linolenic acid, a plant-based omega-3. They also contain melatonin and L-arginine, a precursor to nitric oxide. Together, these compounds relax blood vessel walls, reduce vascular inflammation, and support the natural nighttime pressure drop your cardiovascular system needs to make. 30 grams, 14 halves, 30 minutes before bed. Write it down. Robert was 69 and had perfect daytime blood pressure readings, but was waking up with headaches and elevated morning numbers that his cardiologist could not explain. A home blood pressure monitor showed him what was happening. His pressure was climbing between midnight and 4 a.m. while he slept. When we added walnuts before bed alongside the other changes, his morning readings normalized within 3 weeks. His cardiologist asked what he had changed. The answer surprised her. The nocturnal hypertension connection is one of the most underdiagnosed patterns in blood pressure management. Your daytime readings can look completely acceptable while your cardiovascular system is under significant stress every night. If you consistently wake up with higher pressure than your evening readings suggested, if you wake up with headaches, if you feel more tired in the morning than the hours of sleep should explain, nighttime pressure elevation may be what is happening. The walnut intervention addresses this directly and inexpensively through mechanisms that are genuinely distinct from what most blood pressure medications target. Now, the fourth thing comes from a flower that traditional medicine in Africa, Latin America, and the Middle East has used for centuries. Modern cardiology has spent the last decade catching up with what those traditions already knew. Hibiscus tea, 3 cups per day. You may know it as sorrel, carcade, or red tea. It has a tart flavor that some people love immediately, and others need to acquire. The chemistry behind it is not a matter of tradition. It is well-documented pharmacology. Hibiscus flowers contain anthocyanins and organic acids, specifically hibiscus acid, that act on your blood vessels in a way that is strikingly similar to a class of prescription medications called ACE inhibitors. ACE inhibitors work by blocking an enzyme that causes blood vessels to constrict. They are among the most commonly prescribed blood pressure medications in the world. Hibiscus does the same thing through its plant compounds, without the dry cough that sends many patients back to their doctors asking to switch medications. A study published in the Journal of Nutrition found that daily hibiscus tea consumption reduced systolic blood pressure by an average of 7 points in adults with mildly elevated pressure. 7 points is clinically significant. That is a number that makes cardiologists take notice. 3 cups per day, hot or cold. No sugar or minimal sugar if necessary, because sugar directly counteracts everything we are trying to achieve. A small amount of honey is fine. One critical note: if you are already taking an ACE inhibitor medication, speak with your physician before adding hibiscus tea regularly. Combining the two can push pressure lower than intended. This is about supporting your treatment, not creating a new problem. Dorothy was 67 and had been on lisinopril for 4 years. Her pressure was controlled, but she was experiencing the persistent dry cough that affects a proportion of people on ACE inhibitors. When she asked her doctor about alternatives, she was offered a different medication. When I suggested hibiscus tea as a complementary support that operates through a similar pathway, she was cautious at first. She discussed it with her cardiologist, who agreed to monitor her numbers carefully. At 8 weeks, her pressure had improved enough that her cardiologist reduced her medication dose. The cough improved proportionally. She told me, "I had been drinking hibiscus tea my whole life growing up and had no idea it was doing anything for my blood pressure. Sometimes what has been with you longest is the most powerful." Before we get to the fifth thing, which is the one I consider most important and most misunderstood, I want to stop for a moment. If this video is connecting dots that nobody has connected for you before, please share it right now with someone you know who is managing blood pressure. Someone who is taking their medication faithfully and still frustrated with their numbers. That conversation might be the most useful thing you do for them this week. The fifth thing requires you to walk to your kitchen after this video and open your cooking oil cupboard, because what is in that cupboard may be the single most consequential cardiovascular decision you make every day without realizing it. Most of the cooking oils that fill supermarket shelves, canola oil, soybean oil, sunflower oil, corn oil, are extraordinarily high in omega-6 fatty acids. Omega-6 is not inherently harmful. Your body requires some of it. The problem is the ratio. For most of human history, people consumed roughly equal amounts of omega-3 and omega-6. Today, the average adult consumes 15 to 20 times more omega-6 than omega-3. That extreme imbalance drives chronic systemic inflammation, the same slow-burning inflammation in your blood vessel walls that stiffens arteries and forces your heart to work harder. Every time you cook with canola or soybean oil, you are adding fuel to that inflammatory process. And it gets worse. These oils are chemically unstable at high heat. When you cook with them, they oxidize. They break down into compounds called aldehydes that are directly toxic to blood vessel walls. Your food does not taste different. There is no visible sign, but the damage accumulates with every meal. The replacement is straightforward. Extra virgin olive oil for anything that does not require high heat, dressings, light sautéing, drizzling over finished dishes. Extra virgin olive oil contains oleocanthal, a natural anti-inflammatory compound with documented cardiovascular benefits. Decades of research support this without serious dispute. For higher heat cooking, real butter, not margarine. Margarine is made from the same refined seed oils we are eliminating. Real butter, ideally from grass-fed cows if available. In reasonable amounts, it is a significantly better choice for your cardiovascular system than the industrial seed oils most people are cooking with every single day. I understand this goes against what many of you were told for decades. The anti-fat, pro-vegetable oil message was everywhere, but the science has moved substantially. As someone who looks at what chronic dietary choices do to arterial tissue, the evidence points clearly in a different direction now. Check your cupboard tonight. If you have canola or soybean oil, you do not need to throw it away this moment. Simply stop buying it when it runs out. Replace it with extra virgin olive oil. That one change, sustained over 3 to 6 months, produces measurable reductions in inflammatory markers and in the chronic arterial stiffness that drives elevated blood pressure. James was 74 and had been cooking with vegetable oil his entire adult life because he had been told it was the heart-healthy option. When I explained the omega-6 to omega-3 ratio and the oxidation chemistry, he looked genuinely troubled. He said, "I switched from butter to vegetable oil 40 years ago specifically to protect my heart. And it may have been doing the opposite?" For his specific cardiovascular situation, yes. The evidence now available was not available 40 years ago. The advice he was given reflected the best understanding of the time. The understanding has changed. The important question is not what you did with the information you had. It is what you do with the information you have now. He switched to extra virgin olive oil immediately. At his 6-month follow-up, his C-reactive protein, a marker of systemic inflammation, had dropped by 30%. His cardiologist was pleased. James was philosophical. He said, 40 years is a long time to spend doing something that was not helping. I am glad I still have time to do something different. Now let me bring these 5 things together, because I do not want you leaving this video with a list you forget by tomorrow. 1. Eat your vegetables first at every meal. Before bread, before rice, before anything else. Controls post-meal insulin spikes that constrict blood vessels. 2. 1 to 2 tablespoons of apple cider vinegar in water with each meal. Improves insulin sensitivity and stimulates natural nitric oxide production in vessel walls. 3. 30 grams of walnuts, 14 halves, 30 minutes before bed. Supports the nighttime blood pressure dip that protects your cardiovascular system while you sleep. 4. 3 cups of hibiscus tea daily. Acts as a natural ACE inhibitor, relaxing blood vessels through the same pathway as a class of prescription medications. 5. Replace canola and soybean oil with extra virgin olive oil and real butter. Removes the primary dietary driver of the chronic vascular inflammation that stiffens arteries and elevates pressure. 5 changes, none requiring a prescription, none expensive, all working through the same fundamental mechanism. reducing the inflammation and arterial stiffness that medication alone cannot fully address. The woman I told you about at the start, Patricia, implemented all 5 changes over about 6 weeks, gradually, one at a time, in conversation with her cardiologist. At her 3-month follow-up, her cardiologist reduced one of her 3 medications. Her inflammatory markers had dropped significantly. She told me, "I have been trying to fix this for 6 years and nobody once asked me about my cooking oil." That is the gap this video is trying to close, not because your physician is withholding information from you, but because a standard appointment does not have time to cover the nutritional biochemistry of blood pressure management in the detail it deserves. The research exists, the mechanisms are documented, the connection between what you eat at every meal and what happens inside your arteries is as well established as any pharmaceutical intervention. It simply does not fit into a 15-minute consultation the same way a prescription does. You are sitting at your kitchen table with more time than any doctor's appointment allows. Use it. The 5 changes I have described today cost less than a single month of most blood pressure medications. They have no side effects. They work through mechanisms that are complementary rather than overlapping with your prescribed treatment. And they address the underlying arterial environment that determines how much work your medication has to do. Your arteries did not stiffen overnight. They will not become flexible overnight. But the process of change begins with the next meal you eat, the next time you check your oil cupboard, the next evening you add walnuts 30 minutes before bed. The direction changes immediately. The results accumulate from there. Your arteries are living tissue. They are responsive. They are not static. The conditions you create for them through what you eat and drink every single day either support their recovery or accelerate their deterioration. You have been making those decisions every meal without the information you needed to make them correctly. Now you have it. The timeline of change when you implement these 5 steps consistently. In the first 1 to 2 weeks, post-meal blood pressure variability typically decreases as the vegetable first approach and apple cider vinegar begins stabilizing insulin response. In weeks 2 to 4, morning readings often improve as the walnut protocol supports nighttime pressure regulation. In months 2 and 3, as the cooking oil change begins reducing the systemic inflammatory load that has been accumulating over years, arterial stiffness begins to decrease measurably. By month 3 to 6, the cumulative effect of all 5 approaches working through complementary mechanisms produces changes that appear in blood test results and in the way you feel. This is not a quick fix. It is a permanent shift in the conditions your cardiovascular system operates within every day. The medications your doctor prescribed are doing specific work at specific points in a complex system. What I have described today fills the gaps that medication cannot reach: the inflammation, the insulin response, the nitric oxide production, the nighttime pressure regulation, the chronic oxidative stress from inappropriate cooking fats. Together, they give your arteries what they need to do their own work more effectively. Do not try to implement all 5 at once. Pick the one that feels most accessible to you right now. The vegetables first approach requires nothing new. The cooking oil change is a single purchase. Start with 1. Make it invisible in your routine before you add the next. Sustainable change does not come from doing everything simultaneously. It comes from one decision, repeated until it becomes simply how you live. Tell me in the comments, which of these 5 are you going to start with tonight? And how long have you been managing blood pressure? 1 year, 5 years, more than 10? I read every comment, and your answers genuinely help me understand what this community is navigating so I can create the most useful content for exactly where you are. If this video gave you something useful, share it with someone who is on blood pressure medication and still frustrated with their numbers. They may have been looking for exactly this explanation without knowing where to find it. I'm Dr. Jake Taylor. Subscribe if you have not already. Take care of yourself, and I'll see you in the next video.